welcome to another episode of Mountain Health Today. I'm Ted Owens, your host, and my guest today is Judy Newland, Chief Operating Officer of the Tahoe Forest Health System. Judy, welcome.
Thank you, Ted.
We'll be talking about all things healthcare and its effect on the broader community of North Lake Tahoe, Truckee, Reno, Carson, and South Lake. We'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host, and my guest today is Judy Newland, the Chief Operating Officer for the Tahoe Forest Health System. But Judy, before I welcome you, you're also the administrator of the Incline Village Community Hospital.
I am, Ted. I've actually been in that position for about 5 years.
5 years, and COO role is fairly new?
That's correct. About 2 years, the Chief Operating Officer for Tahoe Forest Hospital District.
Well, thank you very much for joining me today. If you would, just for the folks at home, give us a little background. How did you end up in the region? How did you end up in healthcare? And how did you end up with the health system?
Well, I'd be happy to, and it's probably a fairly common story. Graduated from college and decided I wanted to come ski for the winter. So worked at a local ski area. And I realized after the ski area it was time to get back to my profession, which is a registered nurse. And I worked down in Reno, Nevada for about a year, and then had the great opportunity to begin working at Tahoe Forest Hospital. And I began there as an emergency room department nurse and filled different roles in the hospital, but most recently, about 5 years ago, had the great opportunity to become the administrator over at Incline Village Community Hospital.
So very carefully, I'll put this, you've seen a great deal of change, not just in healthcare itself, but a great deal of growth in the North Tahoe region and the delivery of healthcare.
That's correct. So a lot of healthcare change in the North Tahoe, Truckee area, over in Incline Village, expansion of both hospitals. And it's been actually a privilege to be able to work for the district.
Now, I understand also that there's been a great deal of what you would term in-migration, people actually from outside just the district. You serve a much broader area than just the district of Eastern Nevada County and Placer, correct?
That's true. So Tahoe Forest Hospital District has always felt and had a responsibility to serve its community, and that's far-reaching. It's not just the Truckee area, it includes Donner Summit, it includes the west shore of Lake Tahoe, it includes Tahoe City, Kings Beach, and we get over into the state of Nevada, and it includes Crystal Bay, Incline Village, but even beyond that, we do have people that come to our area as visitors, but also from the Carson area, from the Reno area, and then even north in California by Portola and Quincy. So we actually service a lot of areas.
Sierraville out of it either.
No, I won't. That's right. I won't leave Sierraville out of it.
Thank you. Let's talk a little bit more about Incline Village. You're the administrator, have been for 5 years over at the Incline Village Community Hospital. Tell us a little bit about that hospital's background, its history, how it came to be affiliated with the health system.
Well, again, the district is responsible to provide health care in their region. And Incline Village Community Hospital actually, I believe, was built sometime in the 70s. And it opened and closed 2 or 3 times. And in 1996, when it closed, the district realized that really they want to make sure that that community has access to health care 24 hours a day, and that it's sustainable, that it doesn't just close in 5 years. And so the district purchased Incline Village Community Hospital in around 1996. And with that, they partnered with the community. They wanted to assure that whatever service they provided there, that the community met the community's needs. And it's a small hospital, so it isn't a hospital that can do everything for everybody, but they wanted to make sure, the district, that what services they had there actually met the needs of that community.
Let me interject something here. You refer to the district, Tahoe Forest Hospital District.
Correct.
Is a political subdivision in the state of California. It's a government district, special district. So the balancing act is very challenging, or was very challenging, setting up the model for a small hospital that exists in Nevada. It stands on its own 2 feet.
That's correct. And so even though Tahoe Forest Hospital District purchased Incline Village Community Hospital, Incline Village Community Hospital, every supply, every piece of equipment, all of the staff that are there, that all comes from the revenue, the net revenue that is generated from Incline Village Community Hospital. So no tax dollars cross over into Incline Village Community Hospital.
Judy, in your role as the administrator over in Incline Village Community Hospital, Certainly, you're operating with a vision, with a mission. Describe that for me.
So the vision for Incline Village Community Hospital as a rural hospital, it's a small hospital, is to make sure that we can increase access to healthcare for that community, to decrease our costs for the consumer and the patient, and to make sure every patient that walks through the doors have a great experience and good patient satisfaction. And so we've really re-looked at our model for Incline Village Community Hospital from moving it to an inpatient. We have 4 inpatient beds, and those are important. We want to make sure that we can admit those patients, but we're moving it more to an outpatient model, making sure that what is it that we can do in that community to help people be healthier, to have access to care, to have providers available. You know, what are those services that people might have to go over the hill for that we can provide that education to, and make sure that they have that 24-hour care that they're seeking for, when, especially in the middle of the night when maybe their child is sick.
Very, very important. You're watching Mountain Health Today. My guest, Judy Newland, the COO for Tahoe Forest Health System and the administrator for the Incline Village Community Hospital. We'll be right back in just a moment. Welcome back to Mountain Health Today. My guest is Judy Newland, COO from the Tahoe Forest Health System, but more importantly for our discussion today, the administrator of the Incline Village Community Hospital. Judy, tell me and our folks at home some of the changes that have been made at the hospital in Incline.
Well, there's been quite a few changes, Ted, especially over the last 8 years. We've had some expansion to our emergency department, where we've remodeled that and allowed state-of-the-art equipment. We've added a new CT scanner, done some work in our X-ray department, but most recently we've done some expansion to the second floor of Incline Village Community Hospital in relationship to a health clinic. We now call it our health center, and we've expanded providers up there. We have specialists up there. We have a cardiologist, internist, pediatrician, along with primary care services. We've added exam rooms. We have a library for patients to come. And one of the things that's really changed up there is what we call our care team. Many rural hospitals are challenged with being able to recruit physicians and primary care physicians, and even nurse practitioners and physician's assistant. And as we look to gain more specialists at Incline Village Community Hospital, we've actually been very innovative in creating a special care team for any member of our community. And what that means is, when you come to Incline Village Community Hospital and you want to see a physician or you want to see a nurse practitioner, you can see any member of our team based on your needs. 1 week maybe you would like to see the primary care physician, and then 3 weeks later you may turn around and say, you know, I really need to see the cardiologist. And we're able to have a medical record that allows every physician to be able to support any patient that comes through and understand your medical history.
So those are a great deal of changes. Is it helpful attracting the type of care providers that you need by making those changes to the physical plant that you described? And those were all internal, but you've made many more than that.
That's correct. We want to make sure that when our patients come through those doors and they go up to the second floor and go to the health center, that we provide a very comforting, warm environment. And so we've been able to make those changes. And actually through the support of our Incline Village Community Hospital Foundation, who has actually given quite a bit to help support some of the growth and changes within the community and the hospital.
Judy, you've described a lot of changes to your care team model, changes to the interior of the plant to better serve the public. But the building itself required much more than that. Even exterior finishes like the siding, which I think you told me was deemed to be combustible, all of that's changed as well.
That's correct. We've actually this past year done some facility enhancements. The outside was combustible, and so we had to do a complete re-siding of the Incline Village Community Hospital. In addition, we've done some air conditioning work, and our future is we're actually do some work with our laboratory department. We want to make sure that the patients that come into our laboratory have a very positive experience. I think, the original that was built in the 70s. And so our next project will be able to really enhance that space when the patients come through.
And those are, not simple changes like one might experience in a residential environment or even a commercial environment. Air handling is heavily regulated for a healthcare facility, and pharmacies are heavily regulated as well. So those are not inexpensive changes, are they?
That's correct. And again, Incline Village Community Hospital really has to do those projects through its own net revenue. The other things we've been able to do, which really haven't been a construction project, are expanding services to members of the community that people can just come and access. An example is for our youth. We have free dental screening annually. We have free fluoride screening annually. We provide health exams for children in sports. We've added diabetic education for a bilingual diabetic education. We go into the schools and partner with the schools and do education on food. And most recently, even with Sierra Nevada College, where we look to provide an open healthcare access for those students. They don't have any on campus, so we want to really be able to be a partner with all members of the community in providing healthcare.
So this, an incredible expansion in services and community outreach, it sounds to me. And this has been all relatively the past few years.
That's correct. Because again, we are challenged in healthcare with really helping people stay out of the hospital. How do we keep people healthy? How do we assure that they can see their physician when they need to see them? How do we make sure that they have access to laboratory service and diagnostic imaging? And so we've really had to look differently at how we provide healthcare in Incline Village.
When we talk about access and healthcare screenings, dental, the things you were mentioning just a moment ago, how does one access that? Is it by appointment? Is it walk-in? How does it work?
Well, for some of those programs, we'll let the community know through flyers or advertisements, because usually it's just one day in a year, and they can just walk through the doors. They don't actually.
That would be for, say, dental.
For dental, for our dental screening, right, fluoride screening. For school exams, they would have to call and make an appointment. And for the education, you would want to make sure that you're knowledgeable in when we provide those services and when that education is available.
And we can provide that information perhaps before we close the show. But right now we're going to take a break. You're watching Mountain Health Today. I'm Ted Owens, and my guest is Judy Newland, the administrator for the Incline Village Community Hospital. We'll be back in just a moment. You're watching Mountain Health Today. I'm Ted Owens. My guest today is Judy Newland. We're talking about the Incline Village Community Hospital. Judy's the administrator there, and we're learning about many changes that have been occurring over on that campus. Judy, tell me, what's the patient load look like at Incline? How many ER visits do you see, and what does that load look like?
Well, most certainly Incline Village, its population in winter probably is about half as its population in summer. And so
Snowbirds and people.
That's true. But then visitors come on the weekend, so we serve visitors that come and people that live there year round, and then people that live there in the summer. We service in our emergency department about 3,800 to 4,000 patients a year. But through our outpatient services, that would include our diagnostic imaging, our laboratory, surgery services, our health clinic on the second floor, our sleep center. We have about 33,000 visits to that hospital per year.
Okay, and again, I want to go back to one point that sometimes is lost on folks. You're a small hospital, but you have to be large to some extent too. Times like Christmas and New Year's and Thanksgiving and the 4th of July, when the population swells, it might be big on a weekend and small on a Wednesday. That's a difficult management task, I would think.
That's true. So we are here, 24 hours a day, 7 days a week at Incline to serve the community. And we really have a very special staff, both medical and hospital staff. They are very dedicated and very committed to that community. And if need be, people will come in if we get busy, and they'll come in from home and help. But we do have a very experienced staff there, both the medical staff and the nursing staff, along with x-ray and lab.
Well, and I'm glad you pointed out their commitment to the community, but the community has a strong commitment to to the hospital as well. That's my view. Is that accurate?
I would agree, and if I could just spend a few minutes, I am honored and privileged to be able to work there and work with the Incline Village Community Hospital Foundation. The foundation in Incline Village is a very dedicated set of 20 individuals that sit on the foundation that not only serve as a ambassador or liaison between the hospital and the community, but they also serve as that liaison between the community and the hospital. And they continually share with myself and with the staff there all the great things that we do, but also what is it that we could do better to serve that community? Perhaps what services? They've talked recently about, Judy, is there a dermatologist specialist that could be here? Is there a GI specialist? But even more important is, I think the community of Incline needs to understand how important that foundation is to assure that they have the health care that they need when they live in Incline Village. And recently, since 2004, the foundation and the community members have actually given over $3.5 million to Incline Village Community Hospital.
Well, that's an astounding contribution, but it sounds to me like what you're describing is a foundation that's a little bit different than most foundations. They provide a very strong component of your community outreach, it sounds.
They do. They want to assure that not only their family, but that their neighbors and that their friends have the health care that they need when they need it. You never know what's going to happen at 2 in the morning, and most certainly this winter with Mount Rose being closed, 267, Carson Pass being closed. I mean, they are isolated. And it's reassuring to know, and I know the community feels this in the foundation, it's reassuring to know that that hospital is there for them 24 hours a day, 7 days a week. And I know I've said that before, but it is really important when you are so isolated to be able to have that health care. And the foundation has partnered with Incline Village Community Hospital in order to provide, again, some new equipment, new services. As I mentioned before, the emergency department expansion, really, the foundation developed $1.25 million for that project, along with Tahoe Forest Hospital District.
And Judy, let me ask a different question about the foundation. First off, very fortunate to have a foundation like that in a rural environment. Not all hospitals that are the size of Incline Village have that advantage. It's fair to say, though, without that support, without that community support and that foundation's hard work and support, that hospital probably would not be sustainable.
I would agree that the foundation and the community is key to the success of Incline Village Community Hospital. Again, in the wintertime, we're talking about a population of 4,500, and then in the summer, certainly a little bit larger, but that's not a big volume in order to support a hospital. And so the foundation has been very giving, working with Incline Village Community Hospital and its community to assure that the services there are needed. Along with that, I actually want to mention the North Lake Tahoe Community Healthcare Auxiliary. We do have auxiliary that participate at the hospital, and they volunteer services, and they have given about, since the opening of Incline Village in 1996, about almost $500,000 to the hospital itself too, in which they've purchased equipment that's in need in order to service the community and the patients.
That is a tremendous amount of support, and I also understand that the members of the auxiliary and of the foundation have an incredible level of passion and ownership. I mean, they really, really covet and care for that hospital. It's theirs. It's a true community hospital.
I would agree, and they are such strong partners for Incline Village Community Hospital. So not only do we partner with the foundation to assure we provide the services and with the auxiliary, but we actually have identified about 20 healthcare partners in Incline Village that we work with. The fire department, the pharmacies there, IVGID that's there. We want to make sure that we integrate all healthcare providers into one area to assure that we can provide everything we can for that community.
Well, I would just like to say that you play a very interesting role in a balancing act, serving as COO for the Tahoe Forest Health System and also as the administrator over at Incline. I just wanted to say one thing. You are a tremendous advocate for Incline Village. You are constantly keeping Incline Village right front, face, and center when you're representing them over in the district. And you're to be commended for that. And I feel your passion for that hospital campus as well. So thank you very much. Folks, this is Judy Newland, the administrator for Incline Village Community Hospital, and also the Chief Operating Officer for Tahoe Forest Health System. Judy, thank you for being here today. I'm Ted Owens, your host. This is Mountain Health Today, and we'll see you next time. Thank you for joining us on another episode of Mountain Health Today. I'm Ted Owens, your host. I'd like to thank Judy Newland, Tahoe Forest Health System COO and Administrator of the Incline Village Community Hospital. Judy, thank you very much for being here. And thank you for watching. We'll see you next time.